It's time to welcome in Dr. Cedrek McFadden as we tackle the questions you have about the coronavirus. The biggest issue right now is this new number that's out. So we want to ask the medical expert here, what do you make? 987 cases announced in one day. That's a new record for the state.
Correct, and I think it's a combination of several factors. It's not just that we're doing more tests. I think the more the tests that we do are actually positive now. We're seeing relaxation of the constraints or the restraints because of social distancing, quarantine fatigue setting in. We've also had recent protests and large groups of people gathering. I think a combination of all of that is contributing to the higher numbers that we see, especially today.
All right, our viewers are posting questions on Facebook. Susan's saying, my doctor's directed me to have a COVID-19 test tomorrow. She wants to know, does it hurt? And how long will it take to get some results?
So the people that have had the test will report that it is uncomfortable. A long Q-tip is placed into the nose to the back of the nasopharyngeal space, and it's twisted to get an actual specimen that can be sent to the lab. You can get results varied from a few hours to a few days, and it really depends on where that test is being done and where it's sent for results.
A lot of people have questions like Jeff's about eating and masks. Like, how do you actually go to a restaurant and sort of protect yourself as much as possible, but still manage to eat?
So wear the masks to the restaurant, wear the mask until you've gotten food and beverage. You know, while you're placing those orders, looking through the menu, good time to still wear the mask. And then obviously as you're eating and drinking, take the mask off, place it back on when you're ready to leave. And also assume that everyone else in the restaurant should be wearing the mask as well and properly distancing within that space.
Linda's wanting to know about restaurants as well. How do you know the food is not contaminated by someone who's infected and doesn't know it?
So you don't, first of all. I mean, you have to trust the restaurants that you're going to, so be very protective of that. But in addition to that, you want to recognize that the temperatures at which foods are cooked may be protecting you to some degree. And so you want to make sure that you're cleaning your hands while you're there and that they're doing the same thing.
And Barbara is saying, is it true that COVID-19 will be worse when temperatures cool off toward the fall, etc.?
So it could if it follows the patterns of other seasonal viruses like the flu. In addition to that, when it gets cooled in the fall, that's when we start seeing the flu again, which again, if you compound this with the flu, then we could potentially seeing more problems at that time.
Well, as the numbers continue to rise in South Carolina, we will continue to have you back next week, hopefully on Tuesday. More of your questions getting answered by Dr. Cedrek McFadden. Thank you, sir.
Thank you.